Welcome back, 642. Now, we have talked about this extensively this morning, but we're getting some more insight into the fact that the state of Texas is experiencing its worst measles outbreak in more than 30 years, with more than 48 cases reported as of Monday afternoon. Majority of the confirmed cases are children or teens who are unvaccinated. The possibility of the highly contagious disease crossing state lines is a growing concern among Louisiana health officials. Texas is our next door neighbor there. Joining us today with what you need to know about this measles outbreak, Chief Medical Correspondent Dr. Hebert. Talking about a couple things today, but let's start there.
Yes, I just want to briefly say about the measles. Measles is very, very contagious, and in New Mexico, they've already had some cases, so that is really close to Texas. So the other side is Louisiana. We know that we need to increase the amount of vaccinations here so that we can keep our herd immunity high. It started to drop last year, and so you know that you're going to be coming in contact with measles, and measles is a very serious illness. It's much more contagious than COVID. You can get a couple of diseases that I can name, and one of them is subacute sclerosing panencephalitis. That doesn't even sound good, so you know that you need to make sure that you get your children vaccinated, and if you are an adult and you are not immune, that is the measles, mumps, rubella shot, and that means that you have to get that MMR and check your titers. You know, it's really important that people recognize that all the folks out there that are talking, especially at the highest levels, that, you know, you shouldn't really get vaccinated, you know, all their children were vaccinated. So just make sure that you get your children vaccinated.
Yeah, it's important when we don't want that spreading.
And also just remember, we got the flu out there. The flu levels are highest that they've been in the last, few years. And we had a young child, 5 years old, die from influenza in this city last week. So, please make sure you get your flu shots. This is nothing to play with, folks. I'm telling you, this is very, very serious. So make sure you get covered. Absolutely.
All right. What else do you want
I
to
kind of want to throw that there's a study out there that are getting some people worked up, and it's about ADHD. The study came out of London, and it's basically saying that if you have ADHD, you have a decreased life expectancy. If you are a woman with ADHD, you have a decreased life expectancy by 8 years, and if you're a man, decreased by 6 years. Now, that is true, but I just like to be very transparent about this stuff because it almost is like clickbait, because it's not directly because you have a diagnosis of ADHD. It's because of people having ADHD. The lifestyle sometimes will increase your stress, which will increase your cortisol, which causes you to have hormonal issues that can cause illness. Also, if you are ADHD and you do not have a lot of impulse control, if you don't have impulse control, that means substance abuse, sexually transmitted diseases, drug abuse, getting into car accidents, all these types of things increase your risk of death. Okay, so when you say that, we're not saying that if you have ADHD that you are necessarily going to die early. It means that you need to get treated, you need to be treated appropriately, you need to have the ways to combat some of this impulsivity, but at the same time, you gotta go to the doctor, because when you are impulsive, you have ADHD, you forget things, which means you don't go to the doctor, you don't get your labs that will tell you if you have illness that is getting much more severe. So please, if you have ADHD, just make sure that you follow up with your doctor and decrease some of your impulsive behavior, because that is what will decrease your lifespan, not the diagnosis itself.
Got to read more than just that, the title or the headline. You got to get into the study. So.
Clickbait and Dr. Google is killing people every day.
Well, we love that you were able to break that down for us. Join Dr. Hebert on WWL Louisiana every Tuesday morning on Channel 4. Also find his segments under the Mornings tab at WWLTV.com so you can read up a bit more on this. Mike?